our second lead story tonight, and that is about how COVID-19 is on its way back. At least India has recorded over 1,800 cases already, and it's a new variant, ladies and gentlemen, called JN.1, said to be a subvariant of the famous Omicron, which had emerged earlier. This JN.1 is said to be extremely immune elusive, which means that it is extremely difficult to detect and very, very lethal and dangerous. We have my colleague Deepak Badana now joining us in the studio for more on that. Deepak, talk to us another COVID-19 variant that is making its way back to the world.
Thank you for having me here, sir. To begin with, this is yet another variant that's come in, and as we've seen with all the variants that have come in over the past couple of years, this has again defied the measures that have been taken to detect it. As of now, I believe there are 5 fatalities already in Kerala, and I believe there are some cases in Karnataka as well. And according to the Ministry of Health, as on Sunday, it was, I believe, around 1,800, the caseload, daily caseload, and it's slowly but steadily nearing 2,000. One can only wonder what is going to happen in the next few days. And it's again China at the focus of it all. It's again emerging all the way from China. We have Dr. Vivek Nangia, Principal Director and Head Institute of Respiratory Critical Care Medicine, Max Hospital, now joining us on the show. We also have Dr. Sunila Garg, Member, Lancet Commission on COVID-19 and Professor of Excellence, Chair, Program Advisory Committee at NIHFM, also with us. Doctors, thank you so much for taking time out to be with us. I'm going to begin by asking Dr. Vivek Nangia, quickly tell us how dangerous is the JN.1 variant of COVID?
So this JN.1 variant that we are experiencing these days is an absolutely new variant. This is a subvariant of Omicron, which I think we suffered in 2022, January, February, March, those months. Since then, it was lying dormant, and now this subvariant has come up. Again, whenever a new virus comes up, we don't have the immune system working against it, and we become prone to illnesses because of this new variant. In some people, in fact, in most people, it is turning out to be mild illness only. But let's not forget that when you have an immunocompromising state, or in the group which is highly vulnerable, like those above 65 years of age, those who have underlying diabetes, cardiac disease, and cancers and other immunocompromising states, in them, even a mild illness can turn out to be a serious one and can be life-threatening. So definitely, while we were always aware that COVID-19 is there in our ecology and will keep coming back, and this is what has happened, we are now dealing with a JN.1 variant, which is a new variant to which our immune system has never been exposed. Okay. So we need to be very, very careful with this variant too.
Right, stay with us, sir. We need to be very, very careful. We'll come and ask you all that needs to be done to make sure that we don't contract this JN.1 variant. Dr. Sunila Garg, my only question at this stage is how, in terms of its ability to spread and how lethal it can be, talk to us. How big a danger are we facing with the JN.1 variant at this particular stage?
Thank you so much for having me on the show. I just wanted to say that, when COVID, made its emergence in the very first point, I like to say that COVID was here to stay. And only thing is, when virus is here to stay, we have to remember that virus will undergo mutations. And this is one of the mutations of, when we say BA.2.86. And, this is, as of compared to the earlier mutations, this is the mutant which has got to be monitored very carefully, because it is, quite capable of, evading our immune responses as well. So I think we need to be vigilant, because we detected it as one of the mutations under surveillance, by INSACOG. So this is where we need to be, quite cautious, because as was pointed out earlier also, that people who are immunocompromised and or elderly, they need to be more vigilant. And as it is, we always say that, we need to follow more of preventive strategies as of mass cultures and all that. We need to be always keeping that in point. So, as this mutation is, supposed to be, as of now, it shows that, it is capable of infecting large number of cases. So that's where, and our borders are very porous. So we need to be very vigilant.
We need to be extremely vigilant is the word coming in from Dr. Sunil Garg. Stay with us. Dr. Nangia, you were telling us, how do we guard ourselves against, what is the best way? Is it or is it time to ring the alarm bells across, health facilities in the country and, state health organizations across the country to ensure that we contain the spread of JN.1 within India?
Yeah, absolutely. I think time has come. We need to go back to our COVID-19 etiquettes and COVID-19 behavior. I think it reminds me of that jingle where, which we used to hear so very often on the FM, on any station of FM, in fact, that do gaz duri, mask hai zaruri. So I think we need to go back and remember all those times when the entire country was devastated with the COVID-19 virus. So we need to prevent that, prevent ourselves from reaching that stage once all over again. So first of all, maintaining safe distance, hand hygiene, using mask, avoiding going to all these overcrowded places. This is also the time where Christmas is coming. There'll be a lot of festivities around, marriages happening, malls will be crowded. So you need to avoid all those things. Apart from that, vaccination is something that I would strongly recommend, that you should go in for COVID-19 vaccine. Also, at this time of the year, the influenza is also very common. So there's no harm in taking the flu shots also, especially by the vulnerable group. So these are all the precautions possibly that you can take, especially people who are traveling from abroad. They need to be especially careful because they are the ones who are more likely to get the virus with them. One more thing that I'd like to highlight here, that if anybody has a cold and cough, the first thing they should do is isolate themselves from the rest of the family. By this, they are not only protecting themselves, but also protecting the others from catching the same infection. This is more of a social responsibility, I feel, that we should all carry out if any one of us was to develop a cold and a cough.
Right. Dr. Nangia, the only question I have to ask is that, at Max Life hospitals, have you already been preparing, knowing the fact that the situation is only going to keep, the number of cases are only going to keep increasing? Are you already preparing, with terms of oxygen cylinders or beds?
So as far as oxygen is concerned, we have our own plant now, so that is not a problem at all. As far as beds is concerned, we do not have any earmarked beds yet because we haven't really experienced any patient yet. But I think the day the patients start pouring in, we'll have all the processes in place. That is not a problem. We have our own ICU, which could be dedicated to respiratory patients and COVID-19 patients especially. And also isolation practices and everything is in place. There's no issue at all.
Dr. Sunil Garg, tell us in terms of what needs to be done at the state government level and the central government level. You have Kerala's health minister saying that it is not a cause of concern when the maximum number of cases have been detected in Kerala. So tell us in terms of government action, what needs to be done when it comes to combating JN.1?
You see, basically one thing which I'll say from the perspective of the governments, that we need to be vigilant, but and we need to be watchful of the situation, and we need to see the type of cases which are coming. At the same time, the message for the public is basically, if possible, for the elderlies and all, the masks should be, in place, and then, we should avoid going to overcrowded places. But as of now, what I will say from the perspective of the government and from the perspective of state governments also, and it was never, said no, that time and again for pandemic preparedness, it is important to do mock drills to see that the system is prepared and we are responsive, so that we do not have a kind of a knee-jerk reaction. So we have got to be vigilant. And the type of cases which are coming, also they need to be watched in, with regard to the severity and the age group, what they're affecting. So overall, we need to be kind of, watching the situation, and our, system, where we monitor the number of cases, we have to be very, very careful, and we need to see that though the cases were there in Kerala, but we also got the cases in Tamil Nadu, also in Karnataka as well. And apart from this, there are 40 countries in the world which already have got cases. So we have got porous borders, and pandemic, was never ruled out again. So we need to be always, be prepared for the preparedness, and then we need to be watchful of the situation.
Okay, you need to be watchful of the situation. Dr. Nangia, quick take from you before we wrap this up. Tell us, in terms of going forward, how does one deal with JN.1? And more importantly, how does one, there's so many, this December seems to be the situation every single time. December, the season, the weather, the cold, it always seems to be giving rise to newer and newer variants. And the BA.2.86, if we're talking about the Omicron subvariant, apparently has 20 different mutations possible. So are we looking at a situation there'll be more variants apart from JN.1 as well coming out?
And I think one factor you missed out was air pollution. That is another factor which is contributing
to
the flourishing of all these viruses and all these kind of illnesses. But yes, you can never be sure. These viruses keep mutating and they mutate all the time. Even a minor difference in the genetic makeup can result into a new strain that may emerge. So we have to be prepared for it. We have to continue following all the precautions. I guess all those precautions need to be a way of our lives now. They need to become the norms that we need to follow and not get surprised when something of this sort comes, or not be caught off guard when something of this sort happens. Okay. So I guess mentally we need to be tuned that this is a virus which is going to exist in our society, exist with us. It has entered our ecology and will keep mutating and keep harming us from time to time.
News9 Plus. Download now.